What do you do when your provider says they are not in your health plan's network? Hi, I'm Kevin Knaus with InsureMeKevin.com, and I have a client who has cancer, and she needed to enroll in an individual and family plan. And we were kind of excited that Anthem Blue Cross for 2022 included Sutter doctors and facilities in the network. And so I said, that's the least expensive plan for you. You're going to get your care. You can continue with your cancer treatment. Then she started making appointments. And Sutter facilities kept telling her, oh, we're not in the network. No, we don't accept that Anthem Blue Cross EPO. When you are ill, when you are in pain, you don't need that kind of crap in your life. When you are in pain, it is not the best time to be making, decisions like that. Now, we had done everything possible. We had checked out the doctors on the Covered California system. We had gone to the Anthem Blue Cross provider search tool and found the doctors and the facilities. Sutter even put out on their website that they accepted the Anthem Blue Cross EPO for 2022. So everything looked good. And even taking those screenshots and trying to show that to the people at the facilities that she was trying to get services from, it just, it didn't register. She contacted the cancer advocate and someone else at Sutter, and really to no avail. And of course, when you call, the Anthem Blue Cross or any member services department, you're talking to a person that's very low on the ladder, and they can't necessarily do a lot of things. I had been communicating with her, and she was at her wit's end, and so I just had to start making phone calls I really couldn't talk to anyone at Sutter. They're not going to talk to an insurance agent. But I did have some contacts at Anthem Blue Cross, and they looked at all of this and said, no, they're in network. That's the contract. So finally, someone at the upper echelon of Anthem Blue Cross got in contact with Sutter. Now, these sort of issues, I'm not going to say that Sutter was wrong or Blue Cross had a problem. This is just the way life is sometimes with these big corporate institutions and bureaucracies and databases. What was discouraging is that the people on the front lines, the people at the office at the imaging center or at the cancer treatment center where she needed to go get her port flush, just really didn't want to do anything. They said, well, I don't see in my computer that we accept Anthem Blue Cross. It's going to be out of network. That's discouraging. But at least we were able to get some resolution for this. So if you run into this, of course, you need to double check that the doctors and facilities are in network with the health plan, and it can be difficult. You have to go generally to the health plan's website and do a search, and sometimes certain facilities just don't come up, and so it can be very aggravating. We've also run into problems where a doctor may be in network with the health plan at one facility, one office, but if you see that doctor at another office, they may be out of network because the office or the facility is doing the billing and they don't have a contract with the health plan. So it can be very disconcerting and very complicated. But if you have an agent, lean on the agent to try and get some resolution. If no one can get any satisfaction and you're absolutely certain that everything that has been represented to you is that these providers are in network, you need to file a complaint. Now, in California, there are two regulating agencies. There's the Department of Managed Healthcare and the California Department of Insurance, and they each handle some different plans. It's stupid. If you are a Covered California member, or you've purchased health insurance through Covered California, those plans, for the most part, are going to be regulated by the Department of Managed Healthcare. So that's where you're going to go to file a complaint. Most HMOs are handled by the Department of Managed Healthcare. PPO plans, usually some of the small group stuff and large group stuff is going to be handled through the Department of Insurance. Also the EPO plans and HSPs, health savings plans sometimes. So you may get bounced around. The Department of Insurance say, oh no, we don't handle that, and you have to go over to the Department of Managed Healthcare. That's unfortunate. They should be very upfront about who they are regulating and not leave it up to people to kind of guess. So you file a complaint, and that will get the attention of the health plans. They don't want complaints. I mean, but complaints are how these regulating agencies find out about systemic problems within the health plans and the providers. Because the providers are also on the hook sometimes for the issues that cause cancer patients to go through all kinds of anxiety. We really don't have a good system for patient advocacy in California. And that's unfortunate, but that's the way it is. So you have to lean on friends and family to make these calls, and associates like insurance agents to push through some of these issues so you can focus on your health. So if you have any questions or comments, I will try and answer them. Go ahead and leave them down below. Otherwise, have a good day. I know it can be very taxing out there in the health insurance world. I'm Kevin Knaus for InsureMeKevin.com.